Welcome. In this lecture, I want to take a look at how focused trauma processing contributes to the conditions that elicit memory reconsolidation. So the practical question here to keep in mind really is what has to happen for traumatic learning to change, not just become more manageable and not just to feel better temporarily, but to actually update in a way that feels sudden, surprising, effortless. I'm Dave Ebaugh, and I'm a licensed clinical social worker, and I'm the creator of Focused Trauma Processing. I developed FTP to help therapists more reliably elicit the kind of transformational change that we hope to see with our clients who've oftentimes been carrying trauma with them for many, many years and sometimes in a lifetime. So let me tell you about a client I had recently named Julie. So Julie is a physician's assistant in neurosurgery. She works in a high-stress environment where decisions can have life or death consequences. She's competent, she's steady, and she's really accustomed to handling high-pressure situations. But she had one demon that was on her shoulder, and that was the fact that she couldn't get on an airplane without taking Xanax. So this was a bit of a puzzle to her. Let me tell you a bit about how this happened. So about a year ago, before she saw me, Julie was flying into Reno for a conference. The plane encountered severe winds on the approach, and the pilot had to abort 2 of the attempted landings and had to pull up. And so on the third effort, the plane hit something like an air pocket or something, and it just felt like it was falling out of the sky. It was very abrupt, and the overhead bins burst open, and baggage fell out, and some, passengers were screaming, and it was just really, truly a terrifying experience. So when she came to see me, the problem wasn't just simply that she was remembering a frightening event. Rather, her nervous system was still treating flying as if it was that helpless, dangerous moment, and it was going to happen again. It would be inevitable. Well, in one 40-minute session, Julie reported a sudden and dramatic reduction of her anticipatory fear of flying. And during the session, she also spontaneously formulated a new understanding of what had happened. And in a subsequent follow-up phone call about 3 months later, she reported that she'd been flying without any difficulties or apprehension since the session, and it was, in fact, very remarkable to her. So that gives us a meaningful question here. What is it that happened in that session that allowed such a rapid and dramatic shift? Well, memory reconsolidation gives us a useful framework. First, the emotional learning has to be active. The client isn't just talking about the problem from a distance. They're not in their head about it. But this relevant learning, this experience, the memory of this experience is online, it's present, it's in the body. The client is really feeling it in the moment. Second, while that learning is active and the client is aware of that learning and the sensations that go with that, something else must occur, something that contradicts what that experience or learning predicts. So this is what we call a mismatch or prediction error. And then thirdly, this new contradictory learning has to be available while the memory is in an updatable state. But the emotional learning predicts I'm trapped, I'm helpless, something terrible is happening, and I can't control it. So more information is not always enough. The nervous system has to experience something that violates the prediction. So the old learning goes like this. The old learning predicts if I go there, I'll be overwhelmed. The new experience becomes I am there and I am still capable. So now we can ask, did FTP create that kind of mismatch for Julie? Well, around minute 30 into the session, we hit a dead end. Julie could access the memory with less distress, but standard rescripting was not moving things forward. She could not simply imagine the flight going differently. So this is where I didn't want her to struggle, because she was genuinely having trouble kind of picturing what a different outcome would look like or a different experience would look like. So I didn't want her to, fake it or manufacture some kind of a response that didn't feel real to her. So instead, what I wanted to do is find something in her life where she experiences this desired emotional state, one that already exists in her life. And so Julie, that state was competence in her work as a physician's assistant in neurosurgery. So I first asked her to really focus and reconnect with that felt sense of herself in surgery, right? So it's the ease, it's the certainty, it's the confidence. And so the point here is that I was not trying to get her to think positively, like, oh, I can do it, I know I'm okay. I was really trying to get her to connect with the emotion state. And so that emotion state would be contradictory to what was normally had been associated with that airplane incident, allowing both realities to be present. One is the airplane memory, and then the other is that state of competence she experiences in her work. And then I added a small but really important reality check. I reminded her there was the pilot. He was experienced. He knew what he was doing. And he corrected for the problem. The plane landed. Nothing terrible happened. Nobody died. The reality check about the pilot connected with her lived experience in neurosurgery. So a complication occurs, a trained professional recognizes it, they respond, they have protocols, they know exactly what to do. And that association came from Julie. It wasn't imposed by me, and it was much more valuable as a consequence because she came up with that spontaneous new association. So the breakthrough wasn't that I had explained the correct interpretation, but rather the new meaning emerged from Julie while the old memory and a contradictory state were both active. And that matters because the change was experienced and not merely explained. So before the shift, the schema predicted this airplane memory means I'm helpless and out of control. If I contact it, I'll be overwhelmed. And during the shift, the actual experience was different. I'm thinking about the plane and I can still feel capable and competent. And that is the mismatch. The old learning predicted overwhelm and helplessness. The experience delivered capability. She didn't simply learn to manage the fear. The fear was suddenly much less available to manage. In the session, she reported a substantial drop in the distress. In the 3-month follow-up call, she reported no difficulties flying since that session. So that doesn't prove the exact biological mechanism, but it is the clinical pattern that we would expect to see when an emotional learning has been updated rather than simply suppressed. And this is the kind of result that you consistently get when you are able to elicit memory reconsolidation in this very specific manner. And FTP teaches you that procedure. So these are the clinical markers that I pay attention to. The change is sudden. A sharp shift happens in the session. There is often a spontaneous reframe. the new understanding emerges from the client. The memory feels different, not just less upsetting, but difference in meaning and in emotional quality. The shift does not depend on repeated coping, homework, or continually talking to the client and trying to persuade them into the new belief. The old response becomes less accessible. The client can remember what happened, but the old emotional reaction doesn't come online in the same way. And the qualification is important. These are markers consistent with reconsolidation, but they're not direct biological measures of this mechanism. So this distinction helps us to both get clinically excited and to be scientifically careful. So we don't want to overstate something that we can't directly prove, but we can certainly benefit from the experience and the anecdotal data that is available, and we can say, hey, something really seems to be happening here. So when I look at FTP through this lens, I see three major opportunities for the mismatch. So first, there's the activation and grounding, and the schema, the mental blueprint, predicts or expects I'm going to be overwhelmed. The experience then becomes I can contact this and return to calm. Secondly, there's the calm recall. And so again, that old schema expects the memory itself is dangerous. However, the experience in the session becomes I can think about it while my body remains safer. And then thirdly, there's the emotional bridging. And again, the schema expects in this situation, I'm going to be helpless. But the experience becomes I can bring competence into the memory. So FTP is not relying on one single dramatic intervention. It gives the client's nervous system repeated opportunities to discover that its prediction is no longer accurate. When a person holds a distressing image in their mind while they're doing eye movements, there's a dual task that's happening, and that seems to tax working memory, and so that reduces the vividness of the emotional intensity. My own theory is that the eye movements create a relaxed state. Many therapists also report similar shifts with bilateral tapping or alternating sound, or even prompted to recall a positive experience. And anything that helps contribute to bringing about a contradictory emotional state in the body, such as a feeling of relaxation while thinking about something distressing, is going to contribute to the reconsolidation process. The point clinically is that the client can remember the difficult material while the body is in a more relaxed or safer state. I am remembering this difficult thing and my body isn't reacting the way that it used to. So then this gives us a very practical question. What prediction is alive right now, and what experience would contradict it? So that question changes how you listen to your client. So instead of only asking, how do I reduce this distress for my client, you begin asking, what is it that the client's nervous system is expecting to happen? So then once you understand that prediction, you can then start looking for the experiences that would violate that. And then with enough practice, those experiences come to mind fairly quickly. And in the FTP course, you'll see examples of sessions where this occurs, and you can observe that for yourself firsthand. So here are 5 takeaways you can begin using immediately. So remember, sometimes the most skillful thing that we can do is to recognize that the nervous system has already done something important, consolidate that change, and stop. That's the end of the session. So how did Julie's transformation happen so fast? Well, the memory was reactivated, a contradictory emotional experience became available, a new learning emerged from within that experience. And in a follow-up phone call, she did report no difficult flying since that session. This clinical pattern is consistent with transformational memory updating through reconsolidation. And so the power of the framework is that you are no longer just following steps, rather you understand what you are trying to create, which is an activation, a mismatch, and then a new learning. Sometimes the most powerful clinical moment happens when a client can hold two contradictory truths simultaneously. One, yes, that was terrifying, and then two, and I am capable. And so we're not talking about positive thinking, and it's not telling the client that the event was fine, but it is helping the old learning encounter a new experience that it didn't predict. And then when that happens, the emotional learning can change very quickly. So this is what we go deeper into in the full focused trauma processing course. How to recognize the active emotional learning and the prediction embedded in it. How to create the right kind of contradictory experience without overwhelming the client. How to bridge resources, competence, and safety into the activated memory. And how to track the moment when the old learning genuinely changes. Also, how to know when to stop, because more processing isn't always more therapeutic. What is important, though, is to point out something's different and get your client to really talk about that and articulate what exactly is feeling different and what they're thinking differently about their experience. So the goal of the course simply is not to memorize the FTP script, but it's really to understand the process well enough that you can kind of improvise it in the moment for the client who's right there in front of you. You know what prediction is active, you know the kind of mismatch that you're trying to create, you know how to keep the client within a workable window of tolerance, and you know what to look for when the change has actually occurred. So if this way of thinking about trauma treatment interests you, then I invite you to take a deeper look at the full focused trauma processing training in the link below. So thanks for spending some time with me, and I hope Julie's case gives you a useful way to think about how rapid trauma transformation can happen in your practice.